The straight line is the come here.
Coming through.
So those are from that room you're coming? Okay. So this is the rectus femoris muscle, the straight line from the patellar border is the rectus femoris. So this is the ASIS to patellar border. This is the vastus medialis muscle. From the middle of the shaft of the femur, we have the vastus medialis. So this is the bulk muscle. So lateral, this is the vastus lateralis. Okay. So between the rectus femoris and the IT band. So this is the IT band is the vastus lateralis. So now today we are going to see for rectus femoris. So vastus medialis. So vastus medialis we have two trigger points. Okay. So this is the medial muscle which is involved mainly in the osteoarthritis OA condition. Okay. So it has that two trigger points. One trigger point at the mid thigh. Okay. One trigger point just above the insertion of patellar tendon. So two trigger points. One trigger point at the mid thigh, another trigger point at the lower part of the thigh, where it attaches to the patellar tendon. So this is the vastus medialis. So patient position we have to make, yeah. So this is the patient position, supine lying with the small pillow or roll towel under the knee to relax the muscle. Okay, pillow. Relax. So roll towel or pillow should be placed under the knee, relax to the muscles. The therapist should stand side of the patient. So next one is the trigger point. So needling I am using is 1.5 inch needle for vastus medialis. Okay, 1.5 inch needle. So needling should be done with a flat palpation. Okay, and muscle is slightly, hip is externally rotated, knee is flexed. So this is the ideal position to see the muscle, vastus medialis muscle. Okay, so knee is slightly flexed and hip is externally rotated and knee flexion. So this is the position to see the vastus medialis fully. Okay, so therapist will stand side of the patient. Next one, 1.5 inch needle should be used. Flat palpation has to be done for the vastus medialis muscle. So needling should be done at the angle of 60 degrees. So this is the quadriceps muscle. So needle should be done at angle of 60 degree, pointing towards the quadriceps. Flat palpation pointing towards the quadriceps muscle bulk. So this is the muscle bulk. So it has to be pointing towards the quadriceps. The same thing we have to do for lower point. Flat palpation 60 degree. So this is 90 degree. You should not do like this. 60 degree pointing towards the quadriceps muscle bulk for vastus medialis. So two trigger points. One is at the mid thigh, okay, and is at the lower part of the thigh before attaches to the patellar tendon. The flat palpation for both things, you have to do the flat palpation, 60 degree angle pointing towards the quadriceps muscle, and lower portion also. And lower portion also 60 degree pointing towards the quadriceps muscle. Okay, so this is the vastus medialis. Understand? So these are two trigger points for vastus medialis. So next one we are going to see is the vastus lateralis. So vastus medialis is the main muscle which is involved in chondromalacia patella, patients with osteoarthritis knee, OA knee, okay, patients with adductor strain, so they have the involvement of vastus medialis strain, okay. Then which conditions? Players, footballers, sports players, they have the involvement of vastus medialis strain, okay. So in which conditions then? Patients after the knee surgery or with the ligament surgery, meniscus injury, meniscus surgery, they have the involvement of vastus medialis muscle. Okay. So next one is the vastus lateralis muscle. So this is the another muscle which is involved in the quadriceps muscle. So vastus lateralis is like same like deltoid muscle. How we do vastus deltoid muscle? It has the borders, anterior, middle, posterior border. Like that, vastus lateralis has this anterior border. This is the posterior border. Okay, so this is the broad muscle. Okay, so it has the multiple trigger points in the muscle. So it has multiple trigger points. Is it visible? So it has multiple trigger points. So the trigger point might be in the anterior fiber or in the posterior fiber or in the bulk, anywhere in the muscle, or it will be in the lower portion also. They have the, in the OA patients, they have the vastus lateralis strain here. For chondromalacia, so all the patients who are having vastus medialis weakness, they having the strain in the vastus lateralis. So these points we have to see. So vastus lateralis, we can go with the 2 inch needle or 1.5 inch needle. Give it 2 inch needle. 1 2 inch needle. So for the vastus lateralis, patient position is side lying. With the supine lying, we have to mark the muscles. The side lying, we have to do the needling technique. Side lying.